have said in the past, and I want to repeat here, that the cessation of movement, the release of people to go wherever they want in the country, was not because we did not expect the COVID positive cases to go up. The President, in his wisdom, with advice from ourselves as the Ministry of Health, decided to do that because we believe that Kenyans have attained a level of care, a level of understanding of this disease, so that it is no longer necessary for the government itself to be the ones following everybody around. You know what you are supposed to do. For me and the ministry, we continue to beg you, we continue to insist that you stay alive. That's our job, is to ask you, please, stay alive. Don't die. Usikufe, tafadhali. Usikufe. We insist that you don't die. And the only way that you don't die is if you follow the protocols that have been very clearly spelled out. Wajua watu walisema wanataka kufunguliwa. Si hata nilisikia waliimba ile wimbo ya Mandela. Freedom is coming. Ikaja on the 6th. Si ikuja 6th. Freedom ilikuja on the 6th. But freedom comes with responsibility. And therefore this responsibility is now with you and I. And therefore what happens next is not the question of what the government does, is a question of what you do. It is not the government anymore. Sio serikali, jukumu la kujikinga sasa imebinafsishwa kwa wewe na mimi. That's where it is, that's where it lies. So good people, fellow Kenyans, let's stay alive. Don't die. Today, in the last 24 hours, we carried out 3,895 tests. Out of those tests, 421 have tested positive. Therefore, we now have 11,673 positive cases in the country. And I have often said, these are the cases that we know of. These are the cases that have been recognized because samples have been taken from them. Assume that the next person standing next to you is positive. Hebu muangalie vizuri. Unamuona? Unamuona Ijapokuwa haonyeshi yeye kwamba ni positive, wewe assume that person is positive. And I am not saying that Dr. Rashid Aman is positive, but I am assuming. Therefore, that's why we are keeping the social distance. And he is also assuming that I am also the same. Because kwa hivyo, let's be careful, good people. Because we now have carried out 230,096 tests in the country. From the cases, 409 are Kenyans, while 12 are foreigners. As has been the trend, 297, almost 300 of those are men or male, while 124 are female. And I have noticed, even when you are driving around the country, it is that figure corresponds with the use of masks. The most serious culprits of not using masks are men. The average female walking around this country has got a mask on. But the men are the ones who are the victims of this offense. And I would like to appeal that we adhere strictly to this to the measures that have been given. The myth also that only old people can get it is also not true. I have said it and you have sung it. You can get it. I can get it. We can all. There you go. So age-wise, a 1-year-old infant, has got is positive, and the oldest is a 93-year-old man. In terms of county distribution, Nairobi continues to lead with 6,491 cases, followed by Mombasa with 1,783, and Kiambu at 640 people. Nakuru stands at about number 9 with 155, as the governor said. And out of all these, 42 counties have now recorded positive cases. I would like to appeal to the people of Nakuru to try and keep that number where it is. And I can guarantee you, if everybody is behaving the way I see you now with masks, then it is possible to do so. But don't do it just because the media is here, or because the governor and I are here, and as soon as we leave, unalete hapa kwa chingo. You know there is no nose or mouth around the neck, so it won't help. So just use it the way it's supposed to be used. I'm also delighted to inform you that 570 patients have recovered from this disease. Out of this, 512 have been on home-based care, while 58 are from our various facilities, bringing the total number of recoveries so far to 3,638. In Nakuru County, we have over 30 recoveries so far, with a few, 25 actually undergoing home-based care. And this is likely to be the trend. Home-based care is likely to be the method going forward that we are going to be using. I cannot thank the healthcare workers enough for what they are continuing to do, especially in movement towards the home-based care. Sadly, we have also lost 8 patients today to the disease. Therefore, our fatality is now 217. Our condolences to the families and friends of those who have lost their lives. Finally, I once again want to make a special appeal to the people of Nakuru County to take extra precaution by safeguarding this great county from being ravaged by this pandemic. The only weapon we have at the moment to fight this virus is by observing the containment measures that we have been advising you. Namely, wash your hands with soap and running water, proper wearing of face masks at all times in public places, maintaining of social and physical distance, and avoiding all forms of gatherings. If we just unite and cooperate with the government, this disease will eventually be a thing of the past. We do not have to go through exactly the direction that others have gone through. We don't have to bury people using dozers, as they were doing in New York and elsewhere in Europe. We don't have to go through that. We can avoid it, good people. Kenyans can save each other. And we can all be happy when we hear that the curve has come down. We are not getting the disease anymore. In certain counties, we have already begun to see decreasing numbers every day. And if we uphold these containment measures, it is possible for us just to slip through and not suffer the same way as others have. And the way to do so, when you are in a hospital like this one, in a working environment, please make sure that you're observing the measures. And it is sad that as we open up, People believe that the opening up then is opening up for everything and normal behavior. I don't want to repeat that if we treat this disease normally, what is it going to do? There you go again. We understand, we know it. So when we hear that in factories, particularly in areas like the EPZ, in Nairobi, in factories they are not observing. As they go around their business of making PPEs and so on, factories must ensure that they do not endanger themselves in the course of their work. I have seen people in garages, in street markets, where people are simply not observing this. And I saw it, even on my way, Governor, from Nairobi, as we pass through the various centers, you can see people in markets who are not observing these measures. You are endangering yourselves. Ukienda sokoni, usinunue mboga kwa mama ambaye hana mask. Kwa sababu hiyo mboga, hiyo unanunua, hiyo mboga ni mbaya. Usinunue hiyo mboga. Sana sana kwanza machungwa. Mtu ambaye hana mask na wewe unanunua machungwa kutoka kwa yeye, utaumbukizwa na hiyo chungwa. Utaumbukizwa na chungwa tu. Kwa hivyo washana na hiyo chungwa. Mwambie yeye avae mask. Even the people who are selling, vendors, ambaye anakuja kwa gari yako kukuuzia kitu na hana mask, anakuja kukuuzia maji, anakuja kukuuzia kitu kingine kwa matatu na hana mask. Unaingia ndani ya matatu ama ndani ya bus, unaingia tu unakaa. Unaangalia hapa nyuma yako iko kimtu kingine anakuja na hata naanza whispering to you. Na yeye hana mask. Mwambie mimi nikikuangalia wewe naona kifo. Ukimwambia mtu hivyo basi atatoroka, ataenda zake, kwa sababu you don't have to take it. It's a choice. Nobody should force themselves on you without a mask to the extent that they cause you to get the disease. We must cooperate, and that is how we are going to save each other. The healthcare workers, before you save others, save yourselves. Before you save others, save yourselves. Because if you are not safe, then you can't save us. All health workers have been on the front line to fight against this COVID-19, and we appreciate their selfless work as they too are at great risk. Today, thanks to the recognition by the county government of Nakuru, specifically His Excellency the Governor and his team, today we celebrate the following health workers in Nakuru for their exemplary work in the fight against this pandemic. Number 1, Dr. Ithondeka Angelina. Angeline? Where is Angeline? You are around, Angeline? Angeline, for those of you who don't know her, is a pediatrician, and for our frontline hospital leadership in COVID-19 preparedness, we recognize your work. She identified hospital champions, and together they led the team in training all the health workers in the hospital. She was key in developing a 6-point hospital plan to cover COVID-19 preparedness. Daktari, congratulations. God will bless you. Number 2, Jacob Rotich. Where is Jacob? Jacob Rotich is the county epidemiologist. Jacob established, mentored, and led surveillance teams. He has also led the community response since the beginning of the pandemic. I am told, Jacob, that any case that is suspicious anywhere, when others are running away, you are the one who runs towards the people. Asante sana. Thank you. Makofi kwa yeye. Number 3, Sarah Mosop. Sarah is a nursing officer. She has been a change management leader, inspired other health workers to join the team handling COVID-19 cases. She has shown exceptional selflessness in service to humanity. Sarah, thank you and congratulations. Jonathan Orida. Jonathan, where are you? Jonathan is a clinical officer, an influenza surveillance officer. He mentored and led testing services and has been available around the clock to collect samples and train others. He has collected more than 3,000 samples. Jonathan, thank you so much. Asante sana. Joseph Budhia. Joseph Budhia. Joseph Budhia is a driver. He has consistently ferried samples to the National Public Health Lab in Nairobi on daily basis. He is also available beyond normal working hours. Budhia, asante sana. Asanteni sana. I just want to congratulate the team and to say that it is not that you are all not working very hard, but we do indeed recognize. Today we recognize this team. Hopefully tomorrow we recognize you as well for the good work that you have continued to do. I know that the governor said that yesterday you got a donation of PPEs, and I would like to confirm, Governor, that we did not also come with nothing. We have come with some 2,000 PPEs for your team, for your healthcare workers, to continue protecting them as much as we can. So I want to once again nataka kusema asanti and allow for questions, unless Governor you have something else to add. Allow for questions from the media and then do the presentation that we are going to do. But before I do so, let me just introduce one or two people from the Ministry of Health who are with me here. I mentioned Dr. Pacifica Onyancha, but we have also got Dr. Rashid. I saw people waving at you out there, Daktari. Dr. Rashid is, works with me as the CAS in health. We also have the tall man behind him, Dr. Amoth. Dr. Amoth is Acting Director General of Health in the Republic. Dr. Nandiri. Dr. Nandiri is Chief Nursing katika nchi yetu hii ya Kenya. Then there was Dr. Bonamamo. Bonamamo is the one who looks after the samples that are brought by Budhia. Budhia, umewahi kumuona huyu mama huko? Umewahi, mnajuana ni kwa sababu ya kuwa huko mara mingi. Asante sana. Who else is here from health? Dr. Salem. Oh, Dr. Salem. Huyu msi unamjua huyu? You know him from around here. He is the one who comes dealing with primary health care, and he's been with us today as well. We have got another team also who are here with us, but I just wanted you to know that headquarters is not asleep, and we are here to support the county government. Thank you very much indeed.